Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
Hello, everyone, and welcome back. Today, we are diving into our Practitioner series. You guys are going to hear a little bit about our different advanced women's health practitioners, what makes them tick, what excites them. And today we are talking to Dr. Maryellen. Dr. Maryellen practices out of our Ancaster location, but she also serves patients across Ontario and loves herself some hormones. So today we're going to be talking about menopause and perimenopause. But first, we all want to know, who are you? What are you about? What makes you the lovely human you are? And how did you get into naturopathic medicine?
Well, thank you so much for having me here today, Sarah. I know we talk every day with the Advanced Women's Health team, but it's nice to be one-on-one.
It's taken us 15 minutes to get this started.
Exactly.
We're just talking on the back end.
But it's nice to finally be giving everybody kind of that inside look on what we do and what Advanced Women's Health is all about. So hello, everybody. I'm Dr. Maryellen. I am the clinical lead at the Ancaster location, one of the naturopathic doctors and other healthcare practitioners that we have on the team. So when I think about my journey, what led me to naturopathic medicine, it's a question I get asked a lot. And I think back to myself at McMaster University. Undergrad, I was, in the life sciences program, kind of ready to see what careers are out there for me. Is it med school? I thought biomedical engineering for a minute, and I was just all about making the most of my learning experience there. And in third year, we had a course that was probably the most impactful course in my undergrad. It was called Health and Disease. And one of the co-teachers, co-professors was our very own Dr. Rita Patel, who was then one of my teachers at CCNM. And she just blew me away when she was telling me, well, not just me, it felt like she was talking just to me, but to the auditorium of third year students, teaching us about naturopathic medicine. And then she laid out what the course would look like over the next semester. And it was all about looking at the top 10 illnesses that Canadians face and looking at the allopathic and the complementary treatments. And we had to do, we researched some clinical trials and effectiveness of the treatments, and we presented that at the end. And that course was instrumental in kind of me doing a deep dive into what naturopathic medicine was. I then reached out to a naturopathic doctor in Burlington who was an absolutely incredible role model for me, especially in the beginning of my career, Dr. Jackie Colello. And I just, that whole summer, I did an experiential learning course with her. So I got, a university credit for being at her clinic, doing projects. I was the first life sciences student to do an experiential learning course with a naturopathic doctor. So the dean of science invited me for lunch. It was pretty exciting. Oh. And then it just kind of set the stage. Then fast forward, CCNM, board exams, here we are. I'm in a career that I absolutely adore. I am so thankful that I get to wake up every day and work with women, people that are, invested in their health and just want to feel better. The community that I've surrounded myself with, the naturopathic space, is just, I'm so thankful for it. And here we are.
Very cool. And how did you get to hormones? Like, how did you start to love menopause and perimenopause and that whole journey?
Yeah, because we don't learn really a lot about, learn much about that in school at all, actually.
Fun fact. Yeah. Like when we go, I think a lot of people, their perception of medical school in general, right, is that you go to medical school and you learn everything you could ever need to know. And like even my friends have no idea what I know, what I don't know, the constant questions I get of like, can you do this or do you do that? So people don't really understand the scope of what we learn, which is a beautiful thing and also a challenge. And that's why, like, that's part of why advanced women's health became what it is, why we're expanding the way we are, is because we need to provide some level of standardization. We need to be able to say, you know what, in school, you get the basics of everything and the advanced of nothing. And so how do I find, as a patient, how do I find a space where I know the type of care I'm going to get? I know the type of conversations. I know if they're going to recommend blood work or not. I know if they're going to recommend $10,000 in blood work, right? We've all heard about that. Your friend goes to a clinic and it's like, oh, now I have to do $10,000 in testing and the supplements. And then we hear about people who go to clinics and it's like, okay, I want only homeopathy. And so there is no standard within our profession because we get a baseline in school. And then we have to learn what excellence looks like to us outside of school, right? And that's where we get to pave our own path. And that's where, like, I've created Advanced Women's Health the way it is so that we can build a team around excellence in evidence-informed principles with women's health, where you can know what to expect. But when we ask questions, I know sometimes when I've listened to these things historically, it's like, okay, well, how did you get into hormones? People are like, I don't know, you learned it in school. And so you thought it was interesting and then you went into it, but that's not necessarily the jam. That's not how she rolls.
Exactly. And you said it perfectly. I always tell people, you know, even students at CCNM, the schooling gives you that toolkit. You have the basics, right? You have the knowledge, and it's up to you to really find what lights you up and, you know, what you want to do with your career, right? So, and that's also partly what led me to you and the naturopathic mentorship. Like, I think I was part of the beta group of
you
your
were
course. Yeah. Back in 2019. So I had just graduated and I was waiting to write my NCLEX exams. And I was like, let's add another course onto onto my plate here. But it was the best decision ever because ultimately it led me to where I am now. But thinking back to what really got me interested in hormones, I have to think about that first clinical experience I had while I was still a student. So I went back to Dr. Jackie's clinic every year. I did an externship there. So part of our fourth year at CCNM is that we have that clinical experience, that internship, and you can opt to do an externship where you're at a clinic, you know, in your community working with an ND. So I did that too in fourth year. And she very much taught me about bioidentical hormone optimization. She taught me about the Dutch test. She taught me about interpreting blood work when it comes to hormones, and that you go on a certain day of your cycle to do blood work. And that changes how, you know, we interpret results. So she was instrumental in kind of teaching me a lot about the world of hormones. And then in my clinical experience, which was very limited at the time, just a year at CCNM, most of the patients that I was seeing, we could tie back their symptoms to some hormone issues, right? So that's really what kind of set the stage. And I thought, you know, something that I'm super interested in, even on a personal level, right? Like looking at our hormones and what we can learn about them. And I think that we get, you know, even thinking to the women in my family going through menopause, you know, it's a terrible experience. It's a very negative thing, a lot of negative words when we think about how we describe hormones and the transitions of life that we go through. And it doesn't have to be that way. Our hormones can be our superpowers if we give them the right tools too, right? We can feel incredible when our hormones are optimized and balanced. So I think that's really how I felt that I could make an impact in the women's health space.
Absolutely. And I think you said it perfectly. Our hormones are viewed still, as much as there's this like whole female empowerment conversation, there's all these types of things, we are still viewing them as a liability. When we're on social, we still see so many conversations. We still see so many justifications. Even myself, like, honestly, I was having a bad day the other day and I was like, oh, maybe I'm PMSing. And I was like, no, you have a very legitimate reason to have a bad day. It has nothing to do with your hormones, but we're so ingrained and we're so cultured to believe that there's a deficiency or there's something wrong with us from a hormonal standpoint that is then causing the issue. That it's what makes us foundationally and fundamentally like the female expression, right? I'll call it that.
That's right.
That is not viewed as a superpower. And so many women come into us being like, I'm burnt out, I'm hormonal, and I don't like that, right? So when you're navigating that space with that patient, what does that look like? You know what I mean? How are you helping to bring them from that space of these hormones are absolutely a liability to this space of feeling empowered and supported and knowing that they can use them as power?
Absolutely. I think I always joke with my patients that I bring up a diagram of the menstrual cycle. So, it changes the education. We teach a lot in this space. In this office, I teach my patients a lot about their health and, what happens. But we think about someone who is still cycling, so still getting periods. I show them what that looks like, from brain to ovary to uterus, right? Like what those changes are as they're happening. And we talk about what makes you feel like almost like your superpowers of that time of the month, right? So what it looks like when your hormones are aligned and in a good space. And then that also helps them feel validated and then we talk about those foundations too, like inflammation, stress, illnesses, nutrition, all of these types of things that also change the way our hormones express themselves, if you will, in the body. So we look at that and really paint the picture to say, okay, you feel like your hormones are in havoc, if you will, a lot of havoc. And then we want to get you to harmony. This is how we get there, right? And it's not always, I always tell patients, we can't always blame hormones because most often than not, we run the blood work and it's not that bad, right? Like there's no glaring, huge excess or huge deficiency. It's that you coined this term, Sarah, but the itty bitty shitty committee, right? Of like these little changes. But I always tell patients that it's those little changes and knowing what's driving those can really be empowering. The more you know about your body, the more you can make sense of those symptoms and know what to do about it. So if that makes sense, that's really what I walk my patients through. And at those different stages of life. So of course, someone who is still cycling, that's going to look a lot different than someone who's in perimenopause versus someone who's post-menopause and beyond, right? So we can't just paint one picture of what hormone health looks like. It really depends on where we're at in that stage of life.
But the thing I love is that, and we talk about this a lot internally, I talk about it a lot externally, you can't paint a picture of exactly what hormonal health looks like for any one woman, for any one experience. Like when we're talking about hormones in that kind of menopausal stage, the levels of hormones are so unique to people. But what we can do is look at all of those things that cause the itty bitty shitty committee. We can look at the blood sugar, we can look at the inflammation, we can look at all of those things that you were talking about. Because what most people don't realize is that your hormones, the reason why hormones can look normal and you can feel like crap is not because you're crazy. It's not because you're looking at a piece of information and as a whole package of who you are as a human. That's not how it works, right? But you're looking at the potential.
That's right.
And then the inflammation and the bugs and your gut and all of those other pieces, your blood sugar, your insulin, all of those other pieces dictate what that potential can do. So if you have hormones, can they work? Right? Can they communicate that outcome? And I think that is the thing that we have such a deep respect for internally, right? When we're having those conversations. And even when we talk about perimenopause, and people are having hot flashes and night sweats and anxiety, and they're having all of these types of things. Yeah, like you're in there mastering hormones and being like, what do we need to do to balance these things? But you are also saying, what's going on with your insulin resistance? Research has shown that is a huge contributor. What's going on with, again, like the bacteria that are living in your gut, all of those things. So I think that's such a beautiful component about even understanding hormonal health, is that it's setting the stage for what could be.
Totally. I love the way you just said that. And a great reminder too that, patients come in and they say, okay, I need to test my hormones because I feel like I'm a hot mess. And often I'm telling them, yes, and we need to test, we need to look at your lipid levels. We need to look at your inflammatory markers, your insulin resistance. We need to look at these other things because those also set the stage for that potential, like you said. So yeah, you described that perfectly.
Your mitochondrial function.
Yes, mitochondrial function as you're drinking your mito formula.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada, But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
So then what does a comprehensive assessment look like in your office?
Oh, great question. So comprehensive assessment, it starts with the intake forms, which arguably are some patients, they don't like it and they like to just kind of skip. Oh, we'll talk about this, skip. But I do my best work when I have time to study the foundations, right? And it's a great reflective opportunity for the patient too, sitting there and doing the intake forms, because you think about things that you may not have thought to piece together, you didn't think were worth mentioning, but it's there. So I say, for anybody out there, do your intake forms and do them well. Take the time.
And do them in advance. I literally have a patient. I talked to a patient last week and she was like, can I get a PDF copy of that? Because she's like, I feel like that's the most comprehensive form. And I, at this point in my practice, I deal with really complex cases. That's my MO. That's what I love doing. And so my intake forms are covering everything. And she was like, I feel like anytime someone asks me to fill in an intake form in the future, I'm just going to take this package and I'm just going to send it out to them. And I was like, yeah, why aren't we giving the space for women to reflect deeply on what's going on in their own timeline? Because we do that in our offices all the time. And I'm stealing your thunder, but my show, no, I'm joking.
No, that's absolutely it, right? Classic.
We have too much fun on the back end.
I know it wouldn't be us if we didn't have this discourse. It's all good. It's all good. But yeah, so it starts with the intake form. And then that really sets the stage. It gets my gears going. What do I need to really pull out of this information? And what's that going to look like in the initial visit? So you can expect, an hour up to, even 75 minutes to 90 minutes of us really talking, diving in. I have a specific set of questions that I need to know in order to make my assessment. But, we talk about everything from what your periods look like. If there's a glaring symptom that you're really wanting to look at, we map that out. Timelines, super important. What was going on, any illnesses, or when was the last time you felt well? These are the type of questions I ask patients. We talk about digestion. I love to know, what does a day in the life look like? What is your home life like? What do you do for work? These things are important because when I give you options for treatment plans, I want to make sure I'm setting you up for success. If I were to have you leave here and I say, okay, eliminate all dairy, gluten, alcohol, sugar, you would never come back because, that's not
go on the air diet.
I roll.
Enjoy your life.
It's not how I roll. So that first visit is really diving in, us getting to know each other, me getting to know your case. Then comes the fun part of, what do I need to know more of? So that's where we rely on testing. So I'd say every patient that comes into this office leaves with blood work recommendations, whether they're done through me or if they're due for, a yearly physical with their family doctor, we use that blood work. If they've been to see a specialist, they send that over. So I always love looking at testing. That's where I also, we bring that testing to when we do case reviews with the team at Advanced Women's Health too. And we, talk about that, but that really sets the stage for the next visit, which builds the plan. And when it comes to hormone optimization.
I have a question.
Yeah.
If you could only do one blood test, what would it be?
The insulin glucose challenge. Hands down.
So Maryellen didn't know I was going to ask this question either. You're going to hear this a lot from my team, but it's because I train.
Yeah, I know. I'm like, insulin glucose challenge for 500. That is the most impactful test in my practice. And yeah, you've taught us about that. So thank you, because it's...
Walk me through why.
Because, okay, first of all, it's a no-brainer. It's $45. Okay.
Yeah, and maximum.
Max. I think that's with the collection fee at Life Lab. I think it's you're paying $45 for this test. All in.
Totally.
Okay. And the amount of information we can get from this test alone, from baseline level, how insulin resistant are you? Or is it, is insulin resistant?
What is insulin resistance? Let's back up. Let's do this.
Okay. So insulin being the hormone that helps to control blood sugar, right? Mm-hmm. So insulin resistance happens when our cells are no longer responding to the amount of insulin that it should take for our blood sugar levels to remain at a normal state. a couple different patterns can happen, but essentially we may need more insulin to get the job done. We may see some, increasing blood sugar levels because we're not responding to healthy insulin levels. But it's a big piece that sets the stage for weight loss resistance, because the more insulin we have in the bloodstream, the more that blocks fat breakdown and the more that can cause weight gain as well. So that sets the stage of what insulin resistance is.
Yeah. And so this test, so normally when people not normally, but often when people are talking about insulin resistance, in the research, they take a measurement of what your levels are of insulin and glucose fasting, and they create this ratio. It's called the HOMA-IR. I think it's useless. Here's why. Think about yourself. The majority of us are not fasting the majority of the day. And the majority of issues, especially in the early stages of insulin resistance, there's 4 to 5 different types before you get to diabetes. The issues don't show up until you eat food. Mm-hmm. And so we use this test. So you go in, they take your fasting levels, then you drink this god awful drink. It's plug your nose and down she goes. Then half an hour, 1 hour, and 2 hours later, they take your blood again. So it's 4 blood draws over a 2-hour period of time. And that maps out how your body responds to carbohydrates. So the reason why we love this test is because people come in confused AF on a regular, right? And they're just what do I eat? Should I eat carbs? Should I not? Should I fast? Should I not? Should I eat 3 meals a day or 6? Never. Should I eat 2 meals a day? You know what I mean? They're asking all of these questions because they're confused. And the reason why they were confused is no one has ever used their body as the reference. So when we have people come into our office and do this test, we're using their body as the reference. We're saying, well, your insulin stayed high the entire time. So do not eat every 2 hours. You should probably eat every 4. Your insulin was high when you first came in. Maybe that means that you need to go longer periods of time overnight fasting, et cetera, et cetera. So we use it in many conditions because it is one of the foundational aspects of health. So I'll get into it a lot more in future episodes, but yeah, everyone's going to answer that question. So then you were getting into hormones. I distracted you.
Yeah. So then tests like that, like the insulin glucose challenge. And yes, we can test hormones. It all depends on the context of what we want to know, and, whether a cycle day 3 or a cycle day 21 sample is best. We talk about that with the patient. We look at lipid levels and we look at inflammatory markers. We look at that A1C, that 3-month average of blood sugar, right? So these are the types of tests that we're doing for a patient. So it's not just hormones. It's actually, all of that foundational information that's really important to know. That also helps us to make that informed consent and decision piece when it comes to, treatments like bioidentical hormone therapy or hormone replacement therapy, which is something that I can prescribe, and some of the other NDs on our team at Advanced Women's Health can do as well with their prescribing license in Ontario. So when that is a treatment option for patients, especially in perimenopause or menopause, we have to make that informed consent piece and that decision-making piece based on risk analyses. So that's where we look at our risk markers for cardiovascular disease, osteoporosis. We look at that and say, okay, yes, you are a great candidate for bioidentical hormone therapy because we've done our research. We've done the, kind of digging and the discovery to make sure that this is a treatment plan that's a great option for you, along with supporting those foundations. So if we've got glaring insulin resistance, we can't just, give you some progesterone and hope that everything's going to be okay. We have to do the work on the gut, the insulin piece, et cetera. So that's where we build out the plan.
So I want to talk about BHRT because you do a lot of it. We talk a ton about it inside. You guys will hear this a lot, but for anyone who's new and listening, our team meets every day and we go through cases. So we're very integrated. We are very collaborative in actuality, right? But we talk about hormones a lot. What is something you wish women knew about bioidentical hormones specifically? Because when I have BHRT consults, that's what people are coming to ask me about. It's 45 minutes of rapid fire fear and questions. There's so much confusion. There's so much overwhelm. So what's something you wish women knew about that?
That it can be a life-saving treatment option for the right person. I cannot scream that loud enough. When personal risk and family history is, minimal and it's a great treatment option for you, it can change your life quite literally. I see it time and time again. And I think there's a lot of fear. And I think that BHRT in the hands of naturopathic doctors is a great thing because we have the gift of time, on our side of things, right? We can spend those 45 minutes to an hour with our patients to chat about that and discuss the pros, cons, benefits, risks. And it becomes a very empowered conversation. And I think that's what women need when they're looking at HRT, bioidentical hormone therapy as an option.
So what are some of the benefits of HRT that you see that I think people don't expect? Because it's the gold standard for hot flashes, right?
Yeah.
So if you have hot flashes, people think about using progesterone and estradiol or Biest or these different forms of hormones. But what are some of the other things that you really love using BHRT for and are mindful of when you're talking about the pros of BHRT?
Totally. So I kind of map it out with the symptoms, like the symptoms that can improve, but then also what sets the stage for that healthy aging, if you will, how we optimize health beyond, right? So if we think about the symptoms, of course, the thing that most women are sitting in that chair, asking about HRT for, it is hot flashes or night sweats, right? But the other benefit, sleep. Progesterone can be fantastic for sleep. Sleep is also, as we know, foundational for setting the stage for good health, right? So sleep, we see even inflammation or joint pain can improve, migraines or headaches. So many of these symptoms that we can blame our hormones for, but when our hormones are optimized, things can work really well. When it comes to unexpected improvements, and this is something that really became obvious to me the longer I was in practice and having more feedback from women on bioidentical hormones, the word that comes to mind is they get their vitality back and feel like themselves again. And I even had one of my dear patients comes to mind because she sent me an email right before her, usually we have a 1 month check-in and then we do a 3 month check-in when we're on BHRT. And it was right before her 3 month check-in. And she said, Dr. Maryellen, I can't thank you enough. I feel like myself again. I'm dancing 3 times a week again. I am painting again. I am just so thankful and happy. And I didn't remember myself like this until we got my hormones optimized. So thank you. And time again, this is the same. I even have I can notice, I have, some women come in at their first visits and, very uptight and they're not well. They're not feeling themselves.
Struggling.
Then they come in glowing, happy, laughing. And
the vaginal dryness doesn't have anything to do with that, though. Those improvements have nothing to do with that,
gosh,
I'm
how
sure.
can we forget about that? Vaginal dryness. I'd say that's up there with hot flashes for sure. But these are the things, right? And then, of course, we have the extra, research shows that getting our hormones optimized helps with that bone health, brain health, heart health, right? Things that we absolutely care about for health optimization as we age. So that's really what I see time and time again. Would you agree?
And I totally agree wholeheartedly. I want to add a couple things that if you do have really good informed consent in your medical doctor's office, then oftentimes they say, okay, we're weighing cancer against cardiovascular benefits. So breast cancer, uterine lining, ovarian cancer, things like that, more uterine lining than anything else. But those being the risk and the benefit being, okay, well, you may have some improvements in your heart health and your bone health. They don't talk about brain health, and they also don't talk about the opposite. So most women have hypertension and cardiovascular disease within the 10 to 15 years after they go through menopause, if they're not exploring these different options. My belief structure is it's not right for everyone. It's not. But at the same time, I think that we're in this evolutionary mismatch moment in society right now, where we have more exposure to food, more exposure to inflammatory insults. We have longer and longer lives and more of them without hormones. And I truly I know they talk about now, they don't talk about menopause as this moment where evolutionary, you don't run out of eggs. It's not a thing. We have ovarian stem cells, but there is a lot of discussion right now about women's function within the historical tribe, shall we say, changing. And so there was this evolutionary role where they wanted women to change from childbearing to performing other functions. And so they stopped being able to bear children at a certain age, which is interesting. I don't know if I believe it, but it's interesting, right? It's an interesting concept. And so from that space, if we're looking and saying, okay, well, during these periods of shift and transition, hormones should shift and transition, right? Puberty, when you get pregnant, postpartum, your identity shifting postpartum, menopause. I think that 50 to 55 years old is far in advance of when women in today's society experience that shift. So there is a mismatch in the shift expectation. And so I lovingly say my menopausal patients, whether on hormones or not, they hit their effort phase, which is why I love working with that population, because they're like, I don't like that friend. I don't like that boss. I'm not dealing with this bullshit anymore. Like they're all about it. And I love that. But I think it's very interesting to me that our society shifts around the age of 65, that the first 10 years after menopause are associated, well, the first 7, but I'll say 10, are associated with the most health ramifications if you don't have hormones, in terms of hypertension, in terms of like neurological changes, in terms of losing 1% to 2% of your bone mass in that period of time. So it's just a very interesting timeline for me. And so I'm like, obviously I'm going to make this decision when I get there. It's going to be a hot minute when I do, but I don't see a world where I'm going to want to be in complete absence of hormones before that shift occurs, that like natural shift of 65 and older. So it's just, I think these are interesting conversations we need to have, because women can oftentimes feel at odds with their body. They're like, I'm at the peak of my career, and now I'm feeling like I can't sleep, and I have brain fog, and I'm tired, and my mood's off. And I think it's a really important conversation to have, that it doesn't have to be that way. As much as people argue with me all the time, well, it's natural, it's normal that we end our periods. Why do we need more hormones? And I'm like, I agree. And I think there's this evolutionary mismatch within when that happens at the moment. But I'm going to get heat on that. Come at me, bro.
No, that's a really good point. And I think that's a really great way to describe it. It essentially, it supports that 7 to 10 years post, right? And that way, sets the stage for that healthy life beyond, because there's, a lot of years after menopause where you should be able to still feel your best. Absolutely.
Yeah. Love that.
Yeah.
So is there anything else that you would absolutely love for women to know about their bodies? Something you want people to take away today that you're just like, okay, if you could know anything in listening to this, it would be X. What would that be?
That is such a good question. So the thing I want people listening to take away from this is that, as cheesy as it sounds, it's never too early or too late to get started on your health journey. If, you wake up and, you kind of feel a little off, or something is just not sitting right, you don't feel like you used to, don't wait until those little whispers of change become glaring symptoms. I mean, we can still help you when they're glaring, don't get me wrong, but you can always get started on your health journey, and there's always something you can do to make an impact. Small changes make huge impact. I tell my patients that all the time. So don't ever think that you are not sick enough, because that's what I find a lot of women feel. They're not sick enough to make a change or have to do something about it. They are okay to go through the day-to-day. But yeah, I'm here to tell you, you can feel better, and we're here to help you.
After though?
Yeah, totally.
Like, that we live in a society right now that essentially says that you need to drive yourself into the floor to be worthy of help, support, and healthcare.
Yeah, I see it every day. How wild is that?
Right. And I think that's a conversation we're going to get into a lot here, right? A lot. But I think even just because there's going to be a lot of people who hear that and be like, yeah, but that doesn't apply to me. Right. That doesn't apply to me. I feel a little bit off, but I'm too busy. I'm overwhelmed. I don't have time for this. You know what I mean? Like, health is not for me. We have an entire society of people who don't identify as healthy.
Yeah.
If you don't identify as healthy, you're not going to take actions from a health promoting space, right? So from that piece, I think if you're sitting in that category, if you just heard Maryellen say that and you're like, yeah, but like my stuff's not that bad. Why did that thought just run through your mind? What standard, what belief, what agreement have you entered into with your friends, your husband, your mom, whatever, your coworkers, that says there's a certain level of shit that everyone needs to tolerate before it's okay to seek healthcare? Because we are that person. You and I were talking before we got on here. You just got a lot of blood work done. You're wearing a CGM. I don't have my watch on right now, but like I monitored my data. I got blood work done last week. I don't feel like shit. I'm not driven into the ground. I want the opportunity to be at my best, right? I am constantly, not from a place of lack, but I am constantly in pursuit of what health looks like for me, how I can feel at my best and thrive at my best and be a living example for people in my world. That doesn't mean that I don't feel good, because I don't even have that like niggling, like, this thing is off. I don't feel good. I'm like, I just want to be my best. So it's really looking at all of those triggers, all of those voices that come into your head, all of those things that come up that say you're worthy of healthcare, you're worthy of support, you're worthy of attention, you're worthy of it when. And just getting really curious around those things. That's the thing. When we have time, we do have the luxury of time. So we get into all of these conversations at the same time as like the hardcore blood work that's so important to get curious about more than anything else.
I love that.
Cool. Thank you everyone so much for listening. If you enjoyed today, we would love your feedback, comments, reviews. Follow us on social at Advanced Women's Health Clinics, and we will chat with you guys soon. Bye.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.